Good morning. We often get asked about the dangers of getting off Suboxone and how dangerous it is to get off of it, how difficult it is to get off of it, whether people should stay on it or not. As everybody probably knows, Suboxone is a maintenance drug that is used for opioid use disorder. It's a long-acting partial agonist, so it goes to the opioid receptors and turns those on, but not 100%. And because it's so long-acting and it's not a full agonist, it doesn't really give a dopamine spike, so it doesn't really get people high. And so it's a good maintenance drug for people who, need to, get into treatment and get off street drugs. And so it's very helpful. For years we've specialized in Naltrexone, which is a opioid blocking drug that goes to those brain receptors, and it blocks the receptors and it takes away cravings and it prevents people. So we're frequently detoxing people off Suboxone and getting them onto Naltrexone. And so when do we do that, and what are the dangers of it? Well, the first thing is coming off Suboxone is never easy. We've got a really fabulous detox to get people off of it in 8 days, although sometimes we extend on very high doses or they've been on it a long time just to make the transition easier. Because the usual way of getting off Suboxone is to wean down very slowly, but that's incredibly difficult, and it often takes a year or two. And even at that, the withdrawal is difficult, and the post-acute withdrawal, the period is never easy. So our detox is found in a quick way, in a comfortable way, but they should always expect that they're not going to feel fabulous month or so. If people have expectations they're going to feel bad for a month, they're usually very pleasantly surprised how quickly they bounce back with their energy levels, their sleep, their irritability. They're just generally feeling good. If people expect they're going to get off of it and have no withdrawal at all, then they're obviously going to be somewhat disappointed, because there's always going to be some transition. So one of the dangers is just not feeling good for a while, and so to expect that. A bigger danger is relapsing back to the opioids. So we don't want to get people off Suboxone until they're ready, until they know that they are going to be able to stay clean and sober. And we look at all the different things that would go into that, whether they're stable in their recovery, they've been off of street drugs for a long time, they've got a stable living environment, their emotions are stable with depression, anxiety, all of that's being well managed. They've got good support systems going with their therapy and with their 12-step meetings or with their smart recovery. And so we look at all of those things before we, agree to do a detox off Suboxone. Because the worst thing that can happen is that you get off the Suboxone and you go back to street drugs. And of course, as everybody knows, fentanyl is out there, and it's so universally potent and dangerous that it's so commonly fatal. So we don't want to have people come off of a drug that's working for them and have them relapse. So that's what we're really looking at. The main danger is making sure that people don't relapse.